I'm Amy Giaquinto, and I am Mama Fix It. And in today's episode, which is part 2 of episode 15, I am going to show you everything you need to recover at home from any kind of surgery, but also more specifically for spine surgery. So come on, let me join you. We're going to talk about the struggles that I've had. We're going to talk about what supplies you need at home and nutrition, exercise, all of it. It's going to be great. Okay, so come on, let's do this.
The biggest challenge I had after surgery was swallowing, and this is really, really common with spinal surgery. It's very hard to swallow when everything is super inflamed in your throat. And it's almost like your body forgets. So the first meal, it wasn't too bad. The second meal was a little tougher. But then after that, it just got tougher and tougher and tougher. So I ended up having to take teeny tiny bites. And it was about, when was it? Sunday, Monday, Tuesday, Thursday. I think it was 4 days after the surgery. I had a really bad day in terms of trying to get food and water down in my system. Like nothing was going down. I would take a sip of something and it would just go and everything. It was just volcanoing back out of my mouth. I could hardly get my pills down. It was really, really challenging. And I went into my primary care provider and, he's like, it's probably just surgery inflammation. And he was right. He was right. Since I'm going to go to the bathroom, it reminded me that when you come home from surgery or while you're still in the hospital, I would definitely ask for some bisacoidal 5 milligram USP laxatives, because if you're on narcotics, you're going to need laxatives. You may also want a stool softener. I didn't find I needed it. I just took the laxatives and it moved things smoothly through the plumbing. So that's what you also want. And also, since your throat has been through so much trauma, I had a lot of trouble with mucus buildup. And my doctor said to go ahead and get some nasal spray. This is just fluticasone propionate. And it's basically generic for Flonase. I also have been using this lovely X-Clear nasal spray in between because you can only use Flonase once a day. That's helpful. And because eating is such a problem sometimes, it's really awful. Sometimes the only way I could get anything down was to lay on my back and angle a straw into my mouth and take tiny sips. Well, I did that, and the other night I got such severe reflux I thought I was dying. Really, really hurt. So having a generic antacid on hand, a liquid antacid on hand, is a lifesaver. So make sure that you have that. Clear any meds that you're going to take with your physician before you take them, because you probably were sent home on a bunch of other medications like pain meds and muscle relaxers and all of that. There are a couple other things that I have found really useful. An analgesic gel is really nice because you can spread it on areas where you still have some lasting nerve pain. And then you don't have to take quite so many drugs. And then lidocaine patches. Lidocaine patches are amazing. Some of them come with menthol and some don't have menthol. I like them both for various reasons, but they tend to kill some of that nerve pain too that's residual from the surgery. I've been really lucky and I haven't had a lot of it, but what I have had has been a little uncomfortable, and the lidocaine patch really helps with that. Salon paws are my favorite. I really like those. I really hate icy hots because they don't stick. I should also mention that you're going to want a thermometer, a really good thermometer, because the last thing you want or need when you get sick after surgery, or even if you don't get sick, but you feel like you're running a fever, is you're going to need to check to see if you are. So let's check. I don't think I am. No, 99.8. It's a little warm for me, but fingers crossed I don't develop a fever. One of the things you absolutely can't live without when you've had surgery is an ice machine. This thing is amazing. Right here. I love this. It hooks up, you just add a little bit of water, and then you put some ice in there, and then it hooks up to these. And then there's this nice big ice pad right here, and it flows cold, ice cold water through this. And let me just tell you, this thing has been a lifesaver for me. I have not had to use as many painkillers as I thought I was going to have to use, because whenever things start getting achy, I just lay down on my ice pad and it feels so good. You can set a timer, you can turn it on, and then it'll come on, and then you can set, turn it time on, for how long you want it on, 10 minutes. And even though you've got the cervical collar on, some of the cold still gets through the padding and whatnot. So, and you get other muscles that are a little sore, and this pad is big enough to like lay flat all over. I highly recommend it, would not go through surgery without it, and I am so grateful that my neighbor is lending this to me for right now.
Okay, so I have another secret. When you're using the ice pad, it can get kind of cold. So I highly recommend having a heated mattress pad, because then you can turn on your heated mattress pad and everything around the ice pad is nice and warm and toasty. So you can stay nice and warm and toasty while chilling all of the muscles that need to be chilled. It's amazing. Two other things you absolutely cannot be without when you come home from the hospital are non-stick hurt-free pads and Tegaderm patches. Tegaderm patches are waterproof patches that you can put over the non-stick pads so that you can take a shower. Because in my case, my doctor said he wanted me to keep the wound dry and I wasn't supposed to be sweating on it even after my 2-week checkup. So I just put one of those non-stick pads over it, and I put the Tegaderm pad over it, and guess what? I was good to go and take my showers. I even took a bath and it didn't get wet at all. One of the other reasons you might want to use a non-stick pad to cover this up is just that, to cover it up. I was walking and one of my neighbors was like, "Oh my God," when she saw it. So I thought, well, you know, maybe it's not the prettiest thing to look at. Maybe I should cover it up. So I did.
Another really important element to healing is making sure you're staying hydrated, and that's easier said than done when stuff doesn't want to go down. So I would recommend getting electrolyte drinks or popsicles even. I really like those Outshine popsicles. Pedialyte pops have been recommended as well. I'm not as big a fan of those. I really like the Outshine ones. And then also as much water as you can get down, even if it's just small sips here and there. But stay hydrated because your body needs water. Every time you get dehydrated, you're going to compromise your body's healing ability and you're going to feel crappy. So drink, drink, drink. While I'm thinking about it, there was one other thing you're going to want at post-surgery, and that is some throat lozenges. I personally was really impressed with these Mucinex sore throat lozenges because they have something that numbs your throat and they don't taste horrendous like some of the other ones out there. I was using them a lot, and then I seem to be having a lot more asthma attacks now too, randomly. So if you have asthma, make sure you have a brand new asthma inhaler. And the Mucinex drops actually work really nicely after you've had an asthma attack to soothe your throat after that too. So yay, got lots of new stuff we're learning, lots of tricks. I feel like having a positive attitude and a good mindset coming out of surgery really helps you recover a lot faster. Maybe it doesn't, maybe it does, but I feel like for me it really does. And you also don't want to have, you don't want to be counting the days from the procedure, like, oh, it's only been 2 days. You want to be saying, it's already been 2 days. It's already been 2 weeks. I only have 2.5 more months to go, or whatever, because that adjusts your brain into thinking, hey, I can handle this. There's an end point. It doesn't make any sense to sit here and dwell on how it happened. You just have to move forward. And that's the other thing too that will keep you in a positive mindset is don't dwell on the how and the why, just dwell on the now. And this is where I'm at now. How can I move forward? Keep your mentality positive. Know you're going to have those crashes and keep moving forward. But it's okay to cry. It's okay to get angry. It's okay to experience those feelings. Just understand where they come from and understand that they're also temporary and work your way back into that positive space. Find somebody else you can talk to. You know, I have a neighbor next door and she just had knee replacement surgery. And so we go for walks together when the weather is okay and it's safe for us to walk outside. And that is amazing. It's so uplifting. And then you don't feel quite so alone because when you're like this, you get pretty lonely. In terms of maintaining a positive attitude, it's really important to think in terms of cans versus can'ts, because so many times we think in terms of can'ts, like I can't drive, I can't vacuum, I can't do laundry, I can't bend, lift, twist, all of that. But think how many cans you can do, because you can still do a lot more cans than can'ts. And when all else fails and you're having a really crappy day, you can always focus on another can that will always be true.
I can always eat chocolate because you know what? It dissolves in your mouth. That'll make the day better. I think in terms of mental health, it's extremely important to stay busy and especially stay busy mentally. So in my case, I asked my sensei if I could continue to come to the dojo, if not just for teacher training classes, which basically we sit on the floor as a group and we discuss challenges with assistant teaching and we come up with and discuss the curriculum for the following week. So there's no movement there. I'm still doing that. I am also still engaging in creating meal trains and doing gift baskets for people at the dojo who, are going through some kind of circumstance or have an injury. And so I'm really trying to keep my foot in the door and I'm trying to keep myself mentally active. And I'm also trying to focus on what I can do to help other people while I'm in this position, because that just really, really, really improves your mental health and keeps you sane while you're going through this.
I think one of the most overlooked parts of rehabilitating yourself is nutrition. If you put crap in, crap will come out, and that is exceptionally true when you're injured and you're recovering from something as major as like spinal fusion. So what I have here is I'm making a lot of smoothies. I've got a little dysphagia, means trouble swallowing, so it's easier for me to do liquids. So in order to get my liquids in, I have a bunch of different smoothie recipes, and I'll share some of those on my website. But the big thing is spinach and greens in everything, because spinach makes you strong. I mean, we all saw Popeye, right? Well, maybe not. I don't know. Right, wrong generation at this point, right? But strength is what we want to build. And spinach has got a lot of good calcium and bone building nutrients. So until then, check out the description below, and I will have my recipes on my website and links to them in the description. Enjoy! Oh God, don't fill me. I can't swallow. Ugh. It's disgusting. You swallow, it goes down, it comes up, it goes down, it comes up, it goes down, it comes up, it goes down, it comes up. Sometimes it comes out your nose, and then you cough. That's what dysphagia looks like. Another thing that I found is really, really helpful is when you have dysphagia to do thicker liquids, and then with the straw, and even a small straw, and then follow it down with a tiny, tiny sip of water. So 1, 2. There it went. Okay, and pray it stays down, because it doesn't always stay down. That is the joy of dysphagia. But at some point, I will start eating solid foods again. This is temporary. The doctor said it should only last about another week. I am 1 week post-op at this point. So yay, I can't wait to eat solid food again. Actually, I'm be honest. See, it's coming up again. Hold. All right, be honest, I really don't care about food right now. I'm not super hungry. This is what I consider a junk food, but it is a junk food that goes down the hatch very easily. So if you do this, and my husband made some dairy-free coconut ice cream. Sorry, good Lord. That's better than it was, believe it or not. He made some dairy-free chocolate ice cream, so I made a milkshake, almond milkshake. Throw this in there with the coconut ice cream, and you blend it up in the blender. Yeah, that'll go down. You can also add other proteins like nuts and seeds. And, worst case, you make something and it burns. A lot of stuff has been burning my throat because my throat's irritated. I've been intubated and, everything's been moved out of the way. So it's got a lot of trauma. So worst case, if it doesn't work, give it to the human garbage disposals in your house. We all have one. One of the biggest things that will also help you besides nutrition and hydration is exercise. And so you want to start exercising as soon as your physician will allow it. My surgeon said I am approved to walk. I can walk as much as I want. So that's what I'm going to do. I'm going to go for a walk. I usually like getting up in the morning and getting out in the early morning sun and going for a walk. But, doing it a couple times a day works really well too. Don't go too far. Gradually build up your distance so that you don't overexhaust yourself and overdo it. Some of us have a tendency to do that. So come on, I'm gonna go for a walk. Oh yeah, let somebody know where you're going, and it might be worthwhile to take a cell phone with you in case you need to dial 911. And watch out, because when you're walking, it's a little hard. You can't see straight down in front of you. So stick to paths that you know, and make sure that you're very careful.
The more work you do right now, the easier it's going to be for you to get back to your baseline level where you were before your surgery. One of the other biggest benefits to exercising every day is you get a lot of really fresh blood flowing into the surgery areas, and that helps to add nutrients and then take away waste material from that area, including inflammation. So it's really great there. And also, what does challenging your bones and muscles do? It encourages bone growth. So the more you're able to walk and follow your physician's instructions, I'm not going to say the faster you'll heal, but potentially the faster you will heal. I'm Amy Giaquinto, and I am Mama Fix It. If you like my series, please like and subscribe. That would be great. I'm trying to get 1,000 subscribers this year. Woohoo! We can do it, we can do it, we can do it. And also, please check out my website, www.amygiaquinto.com. On it, I've got some great merchandise and stuff that you won't find anywhere else. It's all created by me. So again, check out my website, www.amygiaquinto.com, and have a wonderful day. And if you're out there recovering, you've got this. We've got this. And go have fun with exploding jelly donuts. Should put an MAD in one. That'd be great, because that's kind of what I feel like happened. Excuse me. That's one of the benefits of surgery. I will talk about that later. It's a side effect. No. Hi, I'm Amy Giaquinto, and I am Mama Fix It. I'm never gonna get through this. I have a superhero button here. Don't push the button. Boop. Oops, my bad.